question about that. When you say it's helped them a lot on the front end, like what is then the second step to that? Say someone gets going on medication and they're responding, then
Mhm.
what? What else needs to happen?
Well, I mean, I think the real work comes in getting someone to help you, whether it's a therapist or a substance use coach. And in fact, there's research has been done that coaching as a modality probably works better than quote one-to-one therapy. And not that there's anything wrong with it. It can be super helpful to have a therapist because you may look at some of the roots of your drinking. But in terms of coaching are usually certified drug and alcohol counselors, some of whom have been in recovery themselves, and they give you the practical stuff to cut down. So looking at your motivations, so things like helping you find alternative activities to drinking. A
Mhm.
lot of people drinking is really specific to an activity or going to the bar or hanging out with this group of friends. And part of what you need to reevaluate is, are there things you can be doing with your time that are better for you? Are there folks who aren't just focused on drinking, maybe you should be hanging out with instead? Are there activities that if it's going to the football game, I always get wasted before the football game. Well, I mean, maybe next time you go and have three or four with your buddies and you don't get wasted, but you still had a good time and drank with your buddies. That's legit. But, things making changes like that. So finding alternatives. I think the other thing people definitely need to do is look at your support network. Who are the people who can support you in this effort? A lot of times it's a partner, could be your kids, could be your siblings, could be your parents, could be your friends. And what you might find is the people who are most supportive among friends are those who either don't drink at all or who are social drinkers. Because the people who are your friends and the context of your friendship is about, drinking a lot. Um, those folks sometimes aren't very comfortable with you if you say I'm cutting down or quitting, and you can get a lot of pressure from long-term friends who you really like to not do it. And again, an adjustment you have to make. You have to look at every aspect of your life. You have to look at your social life. Another thing that's very helpful in cutting down on drinking is making some healthy practices, things that give back to you that don't involve drinking. Lots of examples of those. Exercise is great. If it's aerobic and running, cycling, that's great. If it's weightlifting, excellent. If it's things more like yoga and Pilates that give you a great workout, but also really refresh your mind. So, having healthy activities, including exercise, is one. A second one is a lot of people utilize meditation to calm their mind, not not needing to go to alcohol. And so, meditation can help you do that. It's a difficult practice to start and continue. It takes discipline. I'm speaking from my own experience as well, but it can be really helpful. Another term for that is mindfulness. You may hear that term. Um, Picking other activities to do that don't involve drinking, whether that's maybe doing something with your kids more, with your partner more, that's non alcohol related. So, really finding a support network and a community that is on board with your goal. What you're likely to find is that there's a lot of other people who've gone down the same road who can be real support to you. And then you don't feel so isolated. So, part of that is not isolating yourself, not feeling alone. I mean, think about how many times that you and your best friend Al Cohol have sat down to have a pity party and drink by yourself. I think anyone who's had any alcohol problems has had that scenario. For some people, it's also useful to track your drinking to get a handle on it. So to try to identify what your triggers are to drink, what's your motivation to drink. On the days you decide to not drink, how did you make that decision? And sort of monitoring also the amount you drink, how long you drink, and what's the context of your drinking. And that's what a coach can really help you with identify what are the patterns that are keeping you drinking. And so it's a matter of creating different patterns in your life. So it's great to keep track of it. Some people even get a breathalyzer. You can get your own breathalyzer. They're pretty inexpensive. I think around $50. You can get your own breathalyzer and track it. And in the program RIA, that's a cornerstone of what we do with treatment at Ria. And Ria actually sort of is on a three-legged stool. Medication assisted therapy. So medication is one part of it. You'll see a physician or a nurse practitioner on the front end to talk about medication. The second leg of the stool is the coaching. And the coaching staff is excellent. Just people with experience and compassionate and caring, and they really know what they're doing, and they actually really do care. They want people to get better and feel comfortable when they're talking. And then the third leg of the stool is what I call sort of the digital platform, the digital aspect of it. And that includes data. The data we have in reducing alcohol use is based upon numbers, and the number we have best access to are breathalyzers. So you, in real time, you give a breathalyzer, and via the digital interface, literally via Bluetooth, you download an app. The app's on your phone. You set up Bluetooth with your breathalyzer. You blow into the breathalyzer, and literally the data gets entered, and something that your coaches and your medical team can review in real time. And it's not meant as a way of checking up on you and getting you in trouble. It's really a way of keeping you accountable and giving some real data. And so you can better understand the patterns that you fall into when you're drinking.
That's really helpful. Thank you for kind of elaborating that more. And I have one more question on the topic of, you were talking about kind of finding the right support network.
Mhm.
And I think often I've heard people say that a challenge for them is when their loved one says, they have a problem with alcohol, they should not continue to drink. Like, alcohol is the problem, we need to get them
Right.
abstinent right away. So what would you advise to the family members or to the person struggling with the alcohol use disorder, when the answer might be harm reduction is a better approach and taking alcohol out of the equation may not be the best first step? How do you kind of reassure them of that, or what do you have to say to those loved ones that just want their,
Yeah,
loved one to stop?
yeah. And I can understand that level of desperation, both among the person who wants to cut down or stop, and also among their loved ones. And yeah, it is true. If you've had major consequences, you should probably plan on making a plan to stop rather than cutting down. That's my opinion. And the way to get to stopping is through cutting down first. I'm a really strong believer in this concept, and I feel like the chances are for you to actually stop drinking for good is to sort of go through a reduction first. And from a physical point of view, then you avoid alcohol withdrawal, which is its own problem. You go from 10 drinks a day cold turkey, you're going to pay the price physically. Again, it works for a lot of people, but I think for a lot of people it doesn't. So what I would tell a family member is like, hey, I think we're all on the same page here. Your son really needs to stop completely because of all the consequences and the chaos it's engendering in his life and yours. But what probably works best is getting there over a period of time and make a goal of cutting down, and eventually then it's easier to stop. So you avoid alcohol withdrawal. If you go from 10 drinks a day to 7 drinks a day to 4 drinks a day to 2 drinks a day to off, and you do that, whatever, a few days or a week at a time, yeah, sure, it's going to take a month to get there, but you're going to have a chance to be better psychologically, utilize coaching, understand your alcohol issues better, and then let the medications do their job. So my sense is that yes, you want to get somebody off, but I believe it works better to do it slowly. And that's not always, but I've seen this work a lot. If people demonstrate they're able to cut down, they might be feeling a little better physically. They might be getting in less trouble at home or at work, and they're going, hey, 4 a day, I never thought I could cut down to 4 a day. And they'll come to you and go, I don't know, I am feeling better, so I want to just keep going on this plan. I mean, I've seen it over and over again. The data we have in reducing alcohol use is based upon numbers, and the number we have best access to are breathalyzers. So in real time, you give a breathalyzer, And via the digital interface, literally via Bluetooth, you download an app. The app's on your phone. You set up Bluetooth with your breathalyzer. You blow into the breathalyzer, and literally the data gets entered, and something that your coaches and your medical team can review in real time. And it's not meant as a way of checking up on you and getting you in trouble. It's really a way of keeping you accountable and giving some real data. And so you can better understand the patterns that you fall into when you're drinking.